On this week's episode, we have Cleveland Clinic neurologist Carolyn Just. She shares how rewarding it is to have a patient say, "I've been struggling to find answers for years, and you gave me answers." Carolyn takes the time to understand her patients. She talks about how making small changes can make a difference. And now to our insightful conversation with Caroline. Hello and welcome to the podcast, Eat Better Food Today. I'm your host, Ken Cunahan, and I'm excited to be sharing insights on why we believe that health and longevity begins with the food we eat. The goal of this podcast will be to inspire, educate, and enable folks to live a healthier life and do it affordably. My wife and I have been on this journey for over 11 years and continue to work on it every single day. Percent of the profits from this podcast will be put towards child hunger, with an initial focus on the poor suburb in America, East Cleveland, Ohio. As a reminder, please subscribe to and rate this podcast. Subscriptions are the lifeblood of any podcast. Our sponsor is Cleveland Kitchen. Think of Cleveland Kitchen as providing easy gut health with their fermented foods, which means better brain health with just 2 forkfuls a day. On this episode, we're grateful to have Dr. Carolyn Just. Dr. Just is a board-certified neurologist at the Cleveland Clinic, specializing in general neurology with a particular focus on women's neurology, neurological health. She serves as the founder and lead of the Neuro-Obstetrics Women's Neurology Program, established in 2022. Dr. Just treats a broad range of neurological conditions, including headaches and migraines, epilepsy, cognitive disorders such as dementia and Alzheimer's, spinal conditions, neurological complications during pregnancy, and menopause. She earned her medical degree from McMaster University in Hamilton, Ontario. Her credentials include Fellow of the Royal College of Physicians of Canada, sounds like a very important thing, and certification in EEG by the Canadian Society of Clinical Neurophysiologists. Welcome, Caroline.
Hello, thanks for having me. Happy to be here.
Thank you.
The Royal College is just Canadian board certification. It's not nearly as fancy as it sounds.
You didn't have the Queen come over, or in this case, the King?
Oh, I did. No, unfortunately not.
So I always get interesting answers to this first question that range from coffee to a full meal. So I always start by asking what you had for breakfast this morning.
I had a smoothie with a protein shake, avocado, kale, mango, and blueberries, and a banana.
And a banana.
Yes.
So a nice balanced start to your day.
Some days it's harder than others, but today was a good day.
Well, I think that's the case for everybody. So can you start by sharing some insights in your journey into medicine, kind of why you went into medicine and how you got to the Cleveland Clinic? My son is a doctor, and he wanted to be a doctor since he was 8 years old. So, and amazingly, he is now practicing in Boston. So
wonderful.
Yeah.
It's so common. At my 4-year-old daughter's daycare, when they had their career week, the top 3 career choices for the 4-year-olds were doctor, teacher, and firefighter. So I hope that those children have similar levels of success.
That would be awesome.
Both of my parents are physicians. They're both retired now, but my dad is a neuroradiologist. So very similar brain-wise, although, again, looking at images rather than practicing. And my mom is a primary care.
Oh, okay.
So very much the idea of medicine was ingrained into our life. Family dinners were often treated like rounds, where going back to when I was 12 or 13, my mom would tell me cases and then hope I would guess the correct diagnosis. So I think it was genetic in a way, and very nurtured throughout my growing up.
Very cool. So you had a lot of encouragement.
It's a great career. You get to play a huge role in people's lives. You get to, as I tell my patients, especially in neurology, the nerdier you are, the more you can help your patients.
Well, he loves what he does. He was meant to be a doctor, just like you're meant to be a doctor.
You must be very proud.
Yeah. So you're also an assistant professor at the Cleveland Clinic Lerner College of Medicine, where you contribute as a clinician educator. Just curious, what are you trying to accomplish with your students besides the science of neurology? Because there's a lot of things affecting doctors these days besides just the science of whatever you're practicing.
Absolutely. I think that I like to fill in the gaps of what is the art of medicine, of what it's like to be a human trying to connect with another human who's sick, and how that's more than just you have this diagnosis, here's a medicine, see you in 3 months. It's figuring out what their goals are, reading into their like micro expressions and their smaller fears associated with what's going on with them, and trying to help them the way they want to be helped, and rather than just putting them into a specific diagnostic box, although you do have to do that too.
I think that's important. I've interviewed quite a few doctors in like functional medicine, integrative medicine, and that seems to be a discipline in the medical field where they are asking a lot of questions before they, let's say, diagnose, versus what you kind of said, the 7 minute kind of get in, get out kind of conversation. Mm-hmm. So
I'm very thankful that Cleveland Clinic allows us an hour with every new patient.
Mm-hmm.
That's not the case everywhere.
No, it is not.
And it's very, very helpful.
So what would you say is the most rewarding being an educator and a doctor?
They're kind of separate. So in terms of being a doctor, my favorite is when someone says to me, oh, I've been like struggling to find answers for years and you gave me answers today. That's my favorite. I think people in many ways do not expect to be cured. They want an action plan. They want to be heard and cared for. They want to understand what's going on with them so they can make an action plan. So that's my most rewarding patient scenario. In terms of students, I have a very visceral memory of what it was like to be a medical student. I feel like you're reorientating to a new job every 2 weeks. You feel like you're not helping, even though you are. You feel like you don't know anything. I'm most happy and I enjoy teaching most when I'm able to foster like a safe learning environment, basically. When I have medical students who feel they can ask me questions, who feel they can ask me about questions that aren't just like straight science questions, when medical students ask me about being a mom and being a doctor, that kind of thing, or a parent and being a doctor.
That's got to be tough, being a doctor, and I mean, a lot of long hours and having a kid or children.
Yeah, it can be, but it's also like all I've ever known, both as a child and a parent. And in many ways, I think it's very good for children to see the adults in their life, obviously prioritizing family, but keeping a life outside of that too. And having goals, having an interest in achieving and making a difference and helping people.
You're also actively involved in, say, public education. I read in your profile and professional development. So can you speak a little bit about what you're involved in those two areas?
There's a few different things I've done throughout my career. In my more junior days, I am a big gymnastics fan. So I did a lot of concussion awareness work. More recently, I have been really trying to promote cognitive health for women in particular, and trying to target not just patients I see, but just the population in general, because, the first risk factor for Alzheimer's is age. The second one is being female. And we know that those symptoms may start around menopause, although that's not usually when dementia starts. And it's been very, very, going back to how rewarding it is when patients feel they have answers and feel they're heard. That population has been, I think, chronically underserved in many ways, like many other populations. So it's very rewarding to do that work.
Very nice. I didn't know that about women. I guess I knew about the kind of the population in general, but I didn't realize women were the most affected.
Yeah, I'm speaking at Cleveland Clinic's Women's Health Symposium on Thursday, so these stats are very fresh in my mind too.
So why the focus on women's neurological health? Why did you decide to focus in that area?
Like all things in life, it was sort of an accident. I am fellowship trained in epilepsy and neurocritical care. After I had my daughter, I gained more insight into how little we know about pregnancy and reproductive health compared to how much we know about the rest of medicine, which is, still we don't know everything at all about the human body, but our knowledge of pregnancy and especially neurological conditions in pregnancy is very much in its infancy. And I was struck by how common it was to focus only on safety of a medicine rather than efficacy or effectiveness of a medicine. I saw just how often the answer was okay, well, this will get better when you're not pregnant anymore, but that's only going to help me in 8 months or 6 months or whatever. Even though I received wonderful care during my pregnancy, that kind of happened at the same time as I met a group of women who, for the past 10, 20 years, have been creating this field of women's neurology out of UPMC, out of Harvard, out of Toronto. And I really found my people very supportive, very uplifting, very collaborative, and have really helped me build the program. So it was an accident, but a very happy one.
Nice, nice. Yeah, that's kind of, I wouldn't say that the East Cleveland project that we're working on is an accident, but it's kind of when I started this podcast, I mean, it's focused on food, as the title says, for health and longevity, but um, I've had the benefit in my life of being able to eat good food, go to good restaurants, etc. So I started by interviewing chefs. And then as I started some of these early interviews, I mean, it's a couple of years ago now, but I started to realize what I was accustomed to and had access to, not everybody does. I mean,
Yes.
they don't have access to good food. They don't have access to grocery stores, good restaurants, just a lot of things that I had taken for granted in my previous career that when I started doing these interviews, it's like, this, there's something wrong here. So that's kind of what's led,
Hmm.
working in this, trying to create the East Cleveland Center. So
Hmm. We're having people start with a handicap, right?
yeah, exactly,
Yeah.
exactly. So kind of, I wouldn't say it's by accident like you're saying, but I kind of say, I don't know. Somehow I feel like I was led into where I am right now, I guess.
It does sort of feel that way when you end
Yeah,
up in the place that just you're meant to be.
yeah, exactly. So what are some misconceptions about brain health that you frequently encounter? Like when you see a patient and then like how do you address them? I mean, there is so much we don't know about the brain. There's just so much information. I don't even know how much of it's good, to be honest with you. I mean, this is not my specialty, but so, anyways, how do you address? What are some common misconceptions, and how do you address those? I guess.
Hmm. The common misconceptions people have is that if they're having issues with their memory, it must be a neurodegenerative or like chronic illness like dementia. And I get
Mm,
that, right? It's the scariest thing. Um, our brains represent ourselves in many ways. So that's a very scary thing to think that you're losing. I find the most profound difference I'm able to make is when people get how much impact things like mood or things like sleep can have on memory and brain function. So, for example, let's say somebody has sleep apnea and 15, 20 times an hour, they're having stopping of their breathing. So, that's what apnea means.
hmm
That means they don't get good quality sleep. That is going to have a profoundly negative effect on memory. And I've lost count of the number of people who've significantly improved their memory function with improving their sleep apnea. The other thing is mood. So there's fMRI studies showing that when people are affected by mood disorders, it changes the pattern of activation in their brain. They have some areas involved in mood are more active, and then other areas, specifically the dorsolateral prefrontal cortex. Don't worry, there won't be a test on that. Is an area of the brain involved in thinking and planning. And
hmm
it is hypometabolic, meaning uses less energy, so not working as well when patients have severe depression or even like more moderate depression, right? And then that helps people understand because there's a nuance there. When someone comes and says, "Oh, I have depression and my memory's bad," they don't want to feel like you're blowing them off and saying, "Oh, it's just your depression." No, it's not just your depression. It's your depression specifically this way. So people feel more heard when they understand more of the science behind it.
Emerging trends, research in neurology. What excites you the most about some of the things that you're seeing right now?
I'm very excited about the work on Alzheimer's because it's fundamentally different than what we've had available for the past 5 years or so. So traditionally, we've been trying to figure out how to stop Alzheimer's.
hmm
When someone has Alzheimer's, when we take a look at their brain, which is unfortunately often happens after they pass away, we see that they have too much of two proteins, and those proteins are called tau and amyloid. We used to have meds that would only help balance brain chemicals kind of downstream of that.
hmm
But now we have medicines that bind, so pick up that amyloid protein and reduce the amount that ends up in the brain, which is pretty cool.
Hmm.
We don't yet have that for tau, but there are many, many people working on that. And that is so, so exciting because it's fundamentally different and gets more at what's causing the problem rather than a downstream effect. So I'm looking forward to those changes. Also, very exciting, the FDA cleared a new serum test for Alzheimer's. So, serum meaning blood. We would
Hmm.
previously have to get at spinal fluid to check for levels of amyloid and tau. And as of a couple of weeks ago, there is now a blood test that does something similar. Very
Oh,
exciting,
that
hugely
is very exciting.
exciting. Still very new, still figuring out how that will fold its way into clinical practice, but incredibly, incredibly exciting.
I interviewed Dr. Schwartz from the Cancer Center here in Cleveland, UH. He's at the clinic as well. And I mean, there's a simple blood test now for like prostate cancer, a PSA test that you get. It's a blood test. So you can kind of get early signs. And I know he's trying to get that out especially into the Cleveland, East Cleveland community and get people tested. Because if you find it early, then you can do something about it. So it sounds like maybe this test that you're talking about, this blood test, would be something similar.
Absolutely.
So that's
I would
pretty
love
cool.
I would love to get to a scenario where hypothetically that's part of the Medicare annual wellness visit, right?
Yeah,
And
yeah.
then the earlier it's much, much easier to prevent Alzheimer's than treat it. So the earlier we're able to kind of get on that, the better.
So why in the area of dementia, Alzheimer's, and I guess maybe a definition there. I mean, when I did the research, it looks like Alzheimer's is a form of dementia. It's not,
Correct.
yeah.
It is not,
So
yeah, exactly.
there's a growth, but it's growing. I mean, more and more people. I think what I read, 57 million people globally have it now. It's going to grow to 78 million by 2030. That's only 5 years away. That's a lot of people getting affected. Why is this happening?
Absolutely. So the number one reason is we're living longer.
Okay.
The decade that you live in significantly increases your risk of getting Alzheimer's. I think it's about 20% of people in their 80s or even higher. Depends which numbers you read. So people are living longer. We're able to keep their hearts beating longer, keep their lungs inflating and deflating longer, but we're a little bit behind with the brains.
What are your thoughts? Because we do talk about food here. So, what are your thoughts on food and its effect on? You mentioned sleep, but any research or thoughts on food and its relationship to dementia, Alzheimer's, or other neurological disorders?
Absolutely. So, um, in general, the research has shown that what's good for your heart is also good for your brain. So, you mentioned that dementia is kind of the bigger term, and Alzheimer's is a subtype of that. One of the next most common ones is vascular dementia, which is just your brain blood vessels getting clogged.
Hmm.
And there are very small ones that get clogged, but there's so many of them that get clogged that it affects your ability to process information and presents as dementia. That group will benefit from the same interventions that help people with cardiac issues. Generally, the Mediterranean diet,
Hmm.
or what's called the MIND diet, which is the Mediterranean diet combined with an hypertension diet, is what we recommend. There's lots of studies. Some have shown benefit, some have not shown benefit. The general trend, though, is that it is likely beneficial both in reducing risk of vascular dementia and likely in reducing risk of Alzheimer's type dementia. And it's important to recognize that some of this data is what we call correlational, meaning it's happening in the same people, but one is not necessarily causing the other, right? So is it possible that people who eat better are also doing other good things with their lifestyle or have access to better healthcare or another factor we're not thinking about, and that's what's affecting their risk of dementia? Yes, that's definitely possible. But we're not able to help with that. That's not something we can act upon. And I think at this point, there is enough evidence and very little harm to incorporating a Mediterranean or mind being the one including antihypertension into one's daily life if one is looking to prevent dementia.
So, what I've never heard of that diet, the anti-hypertension diet. What is that?
Yeah, DASH
Mediterranean.
diet. DASH
It's a
diet.
what?
The DASH diet might be what you've had it called as. It basically just like reduces blood pressure from lifestyle. So it's a lot of reducing sodium, trying to flip sodium for like potassium salts, trying to avoid processed foods because they tend to have like nitrites and high sodium content. It's basically the Mediterranean diet minus any salt rather.
Interesting. So, what do you think some of the biggest challenge? Because, well, if we talk about East Cleveland for a second, so in that
Yeah.
neighborhood, there's no grocery stores.
Yeah.
There's a lot of processed foods, so they probably have a higher propensity for, I'll say, any kind of chronic disease, which is why Dr. Schwartz is working in there from a cancer standpoint. So, what can I guess people be doing in some of these neighborhoods working with the clinic? I know Stephanie Tubbs Jones is right around the corner from where we are. But what can you recommend people be doing, I guess, from a food diet standpoint in neighborhoods such as that?
Absolutely. So we have to recognize that some stuff that's given a bad rap is actually given an unfair bad rap. So frozen fruit, great option. Often cheaper if it can be gotten in some way. It has more, like if you have to go out of that region to get at frozen food and then bring it, it lasts way longer. So frozen fruit will have a much longer shelf life than fresh fruit, which will last maybe only a few days, right? The other thing that we can do is advocate for better access to these things, advocate for there to be lower cost options that are healthy rather than fast food options that are so low cost. We can also do the things that aren't as perishable. So olive oil, replacing olive oil with butter is a great intervention one can do to be more aligned with a Mediterranean anti-inflammatory diet. And that's a pantry food, right? It doesn't have to be refrigerated. It's accessible. I think the other thing is providing education. Most people want to make the right decisions for their family, for their kids, but it's hard to
Yes.
make those decisions when you go on social media and it says, "Oh yeah, cans are going to kill you, and if you have frozen food, don't even bother eating it." And it's just we have to remember that social media is designed to shock us, and that's what it's trying to do. So it's not designed to make you feel good about what you're already doing or give you the most accurate, nuanced information. It's designed to keep you there. So encouraging people to seek resources or areas for research that are validated, like the Cleveland Clinic library, like similar health systems library, like Mayo has a similar library. Those are great options for getting information that's not at it doesn't sound like crazy science talk. It's written at a very accessible level. I write some of them, only a few. It's definitely a huge group effort. They're written so that they're very accessible, and getting information there, making decisions based on that is going to lead to greater success and much less stress than trying to get information from TikTok.
I agree. Yeah, it's kind of like we used to have to deal with three news outlets on television, and they had the same approach, try to get your attention. I'll say the shock treatment. Now we've got a lot of different outlets that are trying to do the same thing to get your attention. So, what do you think some of the biggest challenges are you face dealing with your patients, and maybe tell a story or two of how you've kind of helped somebody overcome, I don't know, anxiety and maybe solved an illness in the neurology space, or just help them. I know you mentioned at the beginning, kind of just helping them to cope by just listening and helping them to understand what's going on.
Absolutely. So one of the things that can be really disabling for people is having a stroke when they're young. So young meaning in their 50s, right, for a stroke. And the understanding of what a stroke actually is really poor. We don't learn this stuff in school. Medical stuff is complicated. It's not the kind of thing you can read one article and really understand. I saw a very nice gentleman who had had a stroke and truly did not understand what he could do to prevent it. He was just like, it came out of nowhere. I think I've been making the right choices. And I'm so scared this is going to happen again because right now, I'm just a little clumsy in my left hand. But what if it happens again next time and I lose my right hand, which is my dominant hand, or I lose the ability to speak? That happened to my grandfather. It was terrible. He died right after. So much fear, so much understandable anxiety. I sat down with this gentleman and we wrote out physically, because sometimes I find that helps patients that they have something to take home that they feel they worked on, and they saw the document come together, so their memory, they're able to learn better. And we worked through every stroke risk factor that I could think of that could have played a role. And we worked on high blood pressure. And this gentleman had not realized that if he had basically run out of his hypertension medicines, and was not able to get in with his primary caregiver for a few weeks. And he really felt like he did not want to bother them to just get a refill to bridge the appointment. And that was like heartbreaking for me. So I told him how important it is to advocate for himself, because I think, speaking as a doctor, I'd much rather hear from a patient and refill a medicine than hear they had a stroke.
Right? Absolutely.
So I helped him reach out to his family doctor for the refill. Actually, I think in that case, I provided the refill just to bridge to his family doctor, and then coached him to next time reach out to his PCP over my chart. We worked on his cholesterol, and he really was trying to eat well, but he didn't really understand what that looked like. So he was just eating less. And that's not necessarily helpful, because you just eat less, you end up very, very hungry, and then you crave more starchy, less healthy foods. He was diabetic, but his sugars really weren't too bad. And he needed some help understanding that sugar isn't just in candy. Sugar is also in some sweet sauces, and sugar's in pop. And there's lots of other things that don't label themselves as sugar. There's a nice marketing trick called fat-free that a lot of marketers put on candy. Well, of course it's fat-free. It's pure sugar. They're just different food groups.
Right. That's how they make up for the fat-free. They add more sugar.
Exactly.
Yeah.
Or, gluten-free vinegar. Well, it never had gluten in it in the first place. So it's all marketing. We talked about, he had really been working on quitting smoking, and he had successfully done that. He was just struggling with when he was stressed or when he was really hungry, which again goes back into eating foods that keep you full for longer. And then he had received a heart monitor from when he had his stroke. It had come in the mail, but he had some issues with not having a fixed address. So the heart monitor had been mailed to his other address that he was no longer at, and was not a safe place for him to visit. So I was able to reach out to cardiology and get him a situation where he could have it put on at the clinic instead of having it mailed to his house, even though most patients much prefer where it's mailed to their house, but convenience means very different things to different people.
Yeah.
And I had that time to have that conversation with that patient because I have enough time with my patients. Trends of reducing the number of minutes in a patient visit are only going to harm patients.
Yeah. Right? I mean, if you can't, understand, like you said, you're having a conversation and things I'll just say misunderstood for whatever reason, because he thought he was doing everything right.
Yeah. And he felt much more empowered and felt heard. And, it doesn't end there. He's going to continue to have questions, and there's lots of things that are still stacked against him. But if you can give people a little bit of a leg up, I think it's worth it.
It's a great story. So I've talked about this a little bit, but I've interviewed, I mentioned at the beginning, I started with chefs for my interviews, and then worked in other doctors. And then I've started interviewing farmers and some other very interesting people as it relates to health and longevity. So, and one of the things I've discovered, in addition to what's going on in East Cleveland, and they're not unique. I mean, there's every urban area in America has an East Cleveland. You were talking about the sugar and the marketing disguises and such, but if you just kind of focus on whole ingredients and a few ingredients, my question is, how does your work tie into these conversations? Do you work with chefs, work with farmers? Or you're just kind of, I'm not sure.
I wish I had better, more linked relationships with those groups. We just don't. I would love to. I wish that we also had a nutritionist or registered dietitian within our group for patients who are really struggling with that.
Yeah, that would be great.
It usually requires a different referral, and sometimes it's hard to navigate because maybe they're a diabetes dietitian, but the patient has other problems too. No, that's not something that I'm doing now, although I would love to be doing that in the future. I do find that because I'm trying to prioritize eating healthy while being really busy, I will sometimes use tricks that I've learned to help my patients. But then, of course, I have privilege that a lot of patients don't have, right? Like I'm
Right.
able to sometimes afford things that are completely like out of reach for a lot of Americans, which is very unfair.
Hmm.
So I have to keep that in mind as well.
Can you talk a little? The clinic is building this new neurological institute, so it's under
Yes.
construction. It's going to be done in 2027. Kind of
Mhm.
what can you tell us about what that's going to be? I mean, I've read some things about it. Sounds pretty innovative and heavy on the technology.
Absolutely. So it's really exciting. Right now, the Neurologic Institute is very spread out. There aren't a lot of opportunities for elevator conversations, which
Hmm.
in medicine and in many fields, but I think in medicine often spark fantastic collaborations. You run into someone, you recognize their name, you're like, oh, I'm working on this project, you want to be involved? And then all of a sudden you've got like a great thing that helps a bunch of patients. So I think that will significantly improve the water cooler meetings, if you will. I understand that there's going to be some software that analyzes gait, so walking. Uh, as a neurologist, if I had to choose like one thing to help me diagnose a patient, it would be watching them walk.
Really?
Thankfully, no one will ever make me choose that. But yes, so like for example, people walk a certain way after they've had a stroke affecting half their body. People with Parkinson's walk a different way.
Hmm.
People with cerebral palsy walk another way. People with neuropathy, so a problem with their nerves, walk a different way.
I've never heard that. That's interesting. Never
Yeah,
heard
so
that
it's
before. Huh.
really I often am watching patients walk from the waiting room without them realizing because then their walking is truly as natural as it can be.
Hmm.
And so Dr. Machado had shared with us that gait analysis may be something that the new building is able to offer in terms of technology, which is very exciting.
Hmm. Very cool. I did not know that was a way to diagnose something.
Absolutely, it's very very cool. It does lead to awkward social situations where I'm at the grocery store and I'm like, oh, that guy has Parkinson's. Does he know?
Do you go up to that person or do you just,
Um, I usually don't because they haven't sought my opinion, and I'm not sure that it's fair.
yeah.
Every so often, if I think that someone is really, really suffering and I can help them with something small, I will.
Hmm.
I'm Canadian, so like my understanding of the American healthcare system back when I lived in Canada was that even like small interactions, like needing to get like a brace for like a foot that wasn't working well, were sometimes not achievable unless you had insurance. So I was in Georgia traveling to like film a documentary that I was in a few years ago, and the gentleman who was helping clean at the hotel that I was staying at had what's called a foot drop, where his foot was flopping
Uh-huh.
every time he would take a step, and that is often it's not fixable, but very manageable if you get like a $30 brace that you can get off Amazon that lifts up the bottom of the foot. You put it in a shoe, it wraps around your calf, and people don't trip and they're able to function a lot better. And so I just passed him a note so that he wouldn't feel like confronted. So that's the only time I've ever actually done a drive-by diagnosis.
Well, hopefully he took your advice because that seems like a
I
pretty
don't
simple
know.
solution to
It is, yeah.
tackle. Yeah.
That's my favorite thing. Going back to how rewarding it is when you're able to do something small just from listening to a patient and trying to look at their problem and solve it.
So you talked a little bit about what you do from a food standpoint. I guess what are your thoughts on encouraging more people to cook healthy meals at home versus we seem to live in a drive-through society these days, which occasionally is fine, but on a regular basis, in my opinion, is not good for you.
Yeah, I agree with you. I like to begin by telling patients that their goal is not to get an A plus. No one is getting an A plus on what they eat. Their goal is to make some small changes and just give themselves a little bit of a leg up.
Hmm.
I will usually suggest things like meal prepping. I'll suggest sources of protein that aren't as expensive as others. Like protein shakes can be really helpful. Tofu can be really helpful and is generally less expensive. I'll try to help patients understand like it's okay if you use frozen food, for example. It's okay if you don't cook everything from scratch, but you make sure that you have some fresh veggies in it. Do what you can, because it's you miss 100% of the shots you don't take. If you don't do anything, then it's definitely not going to be good for you. So make
Right.
some small changes, see if you enjoy it, do what you can that works for your family.
And I would just say, I mean, spices are very inexpensive and they can add a lot of flavor to about anything you're making. So, I
Oh,
mean,
such a good point.
yeah.
Yeah, such a good point. I also talk to patients about, like, they're like, "Oh, I just like the meat flavor." Well, like, there's like broths for a reason, or like bone broth, for example, which is like
Hmm.
a nice source of protein that adds great flavor and is often shelf stable. So,
Yeah, yeah, you can buy it in a box and just kind
mhm.
of, yeah, last for a year. I mean, so first step, if somebody, so you kind of talked about this earlier, but if somebody feels like they might have a neurological disorder,
Mhm.
regardless of what it is, and they wanted to figure out if they did or did not, what would you say a first step would be for a patient, whether you're meeting with them or if they're just, I don't know, maybe listening to this podcast and just trying to
Mhm.
figure out what a first step should be? What would you recommend?
Absolutely. So the first step is see a general neurologist. At the Cleveland Clinic, we have world experts, but that also means we have subspecialists. So getting a diagnosis is easiest when you see a generalist first, who can then direct you to the world-class specialists that you need to see. We have, I don't even think I have the numbers, but dozens of general neurologists within the Cleveland Clinic system. I'm one of them, all over. Plus, you don't have to come to downtown main campus. There's some on the east side, some on the west side, some in the south end, so that we can gain an understanding. As I said, some aspects of neurological diagnosis is just watching you walk and doing the rest of the neurological examination, which takes about 15 minutes, in addition to taking a history. And then we can direct you. Okay, well, you're having trouble with walking. That could be that you have Parkinson's. That could be because your knee hurts. That could be because your nerves in your feet aren't telling you where, like, how to balance properly. There's so many different ways, and the first step is to see a general neurologist. It depends on your insurance. Some will require a referral to see a
Hmm.
general neurologist. Others will not.
Okay. And you brought up sleep earlier as well. I just want to put because a lot of people are not sleeping well or sleeping long enough. And I've talked to
Mhm.
enough people that think they get by in 4 or 5 hours of sleep. So, I mean,
Yeah.
that's, if you think, especially as you get older, because I'm in that category, I mean, getting enough sleep is extremely important.
Yeah, it really is. Chronic sleep deprivation, we've seen, has negative health outcomes kind of across the spectrum. The There are people who have their whole life needed only 4 or 5 hours of sleep. But those people are actually few and far between. For people who are waking up unrefreshed, for people who are sitting down to watch TV and then within 2 minutes are snoring, those are signs of sleep deprivation.
Yeah.
And that's likely a clue that your sleep can be improved. And sometimes it's something small, like avoiding access to blue light devices. So we're all guilty of looking at our phones before bed, but if you flip it over to night shift mode rather than regular mode, or
Hmm.
just turn off blue light, then it's much less likely to disrupt your sleep. There's people who have sleep for 8 hours, but it's worried sleep, and they kind of intermittently toss and turn and worry about things. And those patients benefit from, like, having something beside their bed where they can write down what they're worrying about so they can handle it in the light of day, because we all
Hmm.
know our stress is, like, our ability to handle stress is worst in the middle of the night.
Yeah, I actually turn on my phone and actually make a note on my phone when I have nights like that. So I'm not sure that's the best solution, but at least it gets it off my mind.
None of us are getting an A+, but we're all trying.
So I'd like to ask the last question here about a recipe. So a favorite go-to recipe that's easy to make, so it has a few ingredients, can make it in less than an hour. Basically,
Ooh, I like
the idea here is to get people to know that they can make things at home quickly, inexpensively, easily, instead of going. I mean, drive-throughs take time too. It's not like it's a 2 second kind of ordeal there. So
that.
that's
Absolutely.
yeah.
Yeah. So I made this last week. It was a big hit. So farro, like the grain farro, which is
Yeah.
shelf stable. It's a whole grain. It keeps you full. It has fiber. So you start by cooking a pot of farro, and then instead of cooking it in water, I cook it in like beef broth or vegetable broth, so that it's a little has more like meat taste to it. I will usually chop up a sweet potato, or if I'm being honest, take one out of the freezer because we're all busy and it's hard to kind of have that stuff fresh. I'll roast that either in the oven or the air fryer. Air fryers are like a great option if you do have that as a possibility. A can of chickpeas, and then I chopped up a cucumber and tomato, and then put it all together. I put Greek yogurt on the side of it, and in the Greek yogurt, I had some like you could either mince the garlic yourself, but if you're like me and you're a little bit lazy, or rather time efficiency focused, as I prefer, you can keep like minced garlic, like do a bunch at the same time and freeze it in little packets in the freezer and just pop them out. And that was ready in like half an hour, which is
Hmm.
honestly more than I usually spend cooking. I usually am a 20 minutes or less kind of woman. And it was family and toddler approved.
Nice, nice. That's a good recipe. That's a unique one too. I don't know that we've had farro.
It's
Yeah.
just so good. I think like
Yeah.
quinoa gets like a lot of fame,
Yes, it
but
does.
farro does not. Farro is the black sheep of the ancient grains or something. I don't know.
It has a lot of nutritional. It's easy to make too. So
And I
that's.
find it's you don't have because quinoa can be like bitter unless you wash it.
Mhm.
Farro doesn't have that problem.
Hmm. Nice. Great. Any final thoughts to leave our listeners with?
I want to make sure I impart that even small changes are great. No one is going to wake up one day and be the perfect eater, the perfect exerciser. But if you make small changes, you definitely won't regret them. And small changes become habits.
Absolutely. If you're not making meals at home today, start by pick a Monday or a Wednesday or whatever day of the week and make
Yeah,
make, make a healthy meal at home and get
absolutely.
even 10 minutes of exercise is good. You don't have to go to the gym. You don't, I mean, that's ideal, but again, to your A plus comment,
Yeah.
even a 10-minute walk is good.
Walk to the ATM, walk to where you need to go. Also, like, I don't usually just cook like just portions for one night. I usually cook like an extra three portions for like usually two of my lunches and two of my daughters. So
Nice. Yeah, we kind of do the same thing here. We'll make enough for at least another two meals after. So, which is great. You're making one meal and it's just take it out of the refrigerator and it's, ready in 5 or 10 minutes. So that's great.
exactly.
All right. Well, thanks. Thanks for being on the show, Carolyn. Much appreciated.
Happy to be here. Thanks for having me.
As I mentioned a few minutes ago, my sponsor is Cleveland Kitchen, the leader in fresh fermented foods. Try Cleveland Kitchen's crunchy and delicious krauts, kimchi, and pickles, packed with probiotics to support your gut health while elevating your meals from ordinary to extraordinary. Cleveland Kitchen, where taste meets wellness. Find it in the produce or deli section of your local grocery store or visit clevelandkitchen.com for more information. And please follow the show every week where you listen to podcasts or on YouTube. Leave comments below or on my website, Eat Better Food Today.